us, but let us go ahead and kick it off. Good morning, everyone, and welcome to today's Share and Learn titled Fluoride Communication in a Hesitant World. I am going to move ahead to the next slide. All right, so we just wanted to acknowledge that the webinar today is funded by the Office of Oral Health within the California Department of Public Health. And the presentations today are the content of the speakers and do not necessarily represent the views or opinions of the California Department of Health, California Health and Human Services Agency, Office of Oral Health, or COTAC. And just a reminder of a few housekeeping things. So we do always record our webinars and try to make them available to all of you afterwards. We use the chat function in Zoom. You should see that on the bottom of your Zoom screen there. And that is where you can add your comments, add any of your questions there. You can share resources. And it's always helpful for us if you have questions, if you can tell us who the question is directed towards. But our team, the COTAC team, will be monitoring the chat and will make sure that your questions are answered. There will be a dedicated time for a Q&A at the end of the presentation, but we'll answer questions as they come in as much as we can. And then, as always, with our webinars and events, we would love your feedback. So if you can take a minute to answer some questions in our evaluation poll towards the end of the webinar, we really, really appreciate it. All right, so let's talk about what we're covering today. Oh, I don't have that on here, actually. Let me go ahead and introduce our speakers. I'm going to go back to the first page. So today we have three speakers. Susan Fisher Owens, who's a professor of pediatrics in the UCSF School of Medicine and a preventive and restorative dental sciences in the School of Dentistry at UCSF. She practices pediatrics at a large FQHC and is the PI for a contract with the State Office of Oral Health on fluoride issues, as well as chairing the California Partnership for Oral Health Fluoride Work Group. Marjorie Stocks is also with us today. She directed the California Fluoridation Implementation Project, is a co-author on the California Fluoridation Manual, and was a fluoridation consultant for the California Dental Association Foundation. Currently, Marjorie works with Dr. Fisher Owens and the Office of Oral Health through a contract with UCSF. And lastly, we have Jennifer Fitzpatrick. She is a registered dental hygienist, and she's currently serving as the health program coordinator for the local oral health program in Sacramento County. Since 2021, she has led the region's community water fluoridation promotion efforts to advance oral health equity. We're thrilled to have all of them here with us today. All right.
Good morning, everyone. Good morning. We are so glad to have you here to join us on this important talk, which is not fun necessarily. It's a challenge to deal with these issues, but I am so glad you are here to help so we can help you and you can help us in working towards them together. We're going to start. I'm thrilled to be joined by two other wonderful speakers. And I will start just by giving you the disclosure. Ms. Stocks is a better person than I and has no conflicts to disclose. I do need to disclose that in the past 12 months, I have served as a member of a data safety monitoring board for Colgate, but not anything I'll be discussing today. We do intend to discuss what is technically an unapproved or investigative use of a product that is fluoride varnish, but I'm sure all of you are already using it, and you know that it's recommended by the American Academy of Pediatrics, the American Academy of Pediatric Dentists, and the U.S. Preventive Services Task Force. So we are well in good stead with this topic. Our comments are our own and do not represent any other organizations with which we're involved. So what we will do is we will start. We have a number of objectives that we will be covering today, and I'm going to jump right into the fire and talk about some of the recent controversies. You know, as well as anyone, how much there is challenge in the literature right now. But a decade ago, it wasn't that way. A decade ago, we were rolling in with headlines like this, describing fluoride as one of the 10 great U.S. public health achievements of the 20th century. And yet, then more recently, We're seeing these very concerning headlines in the past couple of years that make you wonder and makes you concern. And in fact, part of how I got to where I am is that I was concerned about them too and decided I needed to read more and learn more. So I want to start, even though I've thrown up this scary slide, I want to start just with a big reassurance that every major medical and health organization is in support of fluoride. So when we look at all of these, and I could fill up my slide with more names and more logos, there is no widely respected medical or health organization that opposes fluoride. So let's center ourselves in that knowledge and then go on to learn a little bit more about the specifics over some of these topics in the last few years. First, we're going to go to just describe some general issues about a few of those recent studies, including the NTP, or the National Toxicology Programs report that came out almost 2 years ago now. There are a number of different issues, and I will try not to go into too much detail, but I think it helps us understand a little bit about why they're problematic and why other ones are more appropriate for us. So the first is that when we look at the subjects and the tests that are used, the subjects are mostly done with studies from India, Iraq, China, and Mexico. And while studies can be very well done there, the fact of the matter is those are all locations in our world where both people drink more water per person than we do in the US. And they also have a baseline higher fluoride content in the water. In addition, those studies do not control for a smoking history or other exposures, including lead or arsenic, which are known neurotoxins. And so if you're not controlling for them, you don't understand what impact that may have on the results as compared to fluoride. Another major issue with these is that they're doing IQ tests on 3 and 4-year-olds. Any of us who have lived or worked with 3 and 4-year-olds know how big of an influence something as simple as a nap or a snack can be on their ability to perform in life. And so for those reasons, it's not a very reliable test. Okay. Third, many of these depend on a single maternal urine test. So one test. Over the course of pregnancy, a woman urinates, can't believe someone studied this, but urinates on average 10,000 times. And that in the course of those urinary tests, in the course of that 10,000 times, you can have different ranges of fluoride based on trimester, based on time of day, based on diet, particularly salt. And so all of those tests, we've gotten 1 out of 10,000, and they're relying on that as though that tells us everything. They also were relying on that, but didn't control for things like the child's birth weight, the diet, because for instance, people who eat a vegetarian diet excrete more fluoride than people who don't. Doesn't control for prepared foods, which is also connected to salt, time of day, and for me, most importantly, smoking history. So there's a number of problems with those tests. There's also a problem with the statistics. But before I jump into that, I just want to give one more visual view of looking at these tests. When we look at the NTP and a study that was based upon that, which was published by Taylor in 2025, got a lot of press when this came out last year because it was published in a very popular journal. It was hailed because they were doing a study based on 74 other studies using a technique called a meta-analysis. And a meta-analysis is a technique that allows a scientist to combine different studies so that you're dealing not with a small sample size, but with a much larger sample size. So it seems like a good thing. 74 studies is a good amount. However, if I show you this next slide, you will see in the yellow are all of the studies that were actually rated by their own evaluation to be at high risk of bias. So 70% were at high risk of bias. 28% of these studies were from non-peer-reviewed journals, which is not a good way for us to base science. 17 of the papers alone were from one journal called Fluoride that is written by people who are fluoride hesitant. And only 7, less than a tenth of the whole amount, were based on fluoride levels that were at below, only 7 of them were based on fluoride levels below 1.5 parts per million. Now, here in the US, we're dealing with ideally 0.7 parts per million with a range of 0.6 to 1. So this is only a tenth of these are even relevant for us. In summary, that is a weak basis for changing public policy when you're basing it on all of this information that may not be right. Okay. So I wanted to drop you a picture like that before I move into the statistics. What I'm going to show you on this slide is 3 main points for the statistical review. The first is that they didn't adequately vet the studies. By that, I mean they didn't make sure these studies were relevant to our population. And actually, before I go through these points, I'm sure your eyes are drawn to this bottom part. I will explain it in 1 second, but it is a table as an example of one of the studies. So let me get to that in 1 second, but I'm going to try to bring your eyes back up here to our top where we see, oh, no, we don't see because I didn't advance my slide. 1 second. 3 points. They didn't vet the studies. They ignored clustering or didn't statistically account for clustering. What clustering is saying that people who are in a group are more likely to behave like one another. And so it's important to understand that group. For instance, if you're doing a study and you're analyzing kids who go to 2 different schools, we need to understand if those schools have the same socioeconomic background, the same exposure to different opportunities. We can't necessarily say those 2 schools are exactly equal, but it's pretty fair to say that probably people who are at one school are more like people who are like people at their own school, and vice versa. People at a second school may be more like people at the second school. So statistically, there are tools. Thank goodness we have very smart statisticians and bioepidemiologists who help us with this and can control for that. A very important example in this is one of these studies that is questionable, clustered by interviewer. And the interviewer got, on average, different scores than other interviewers. Then that's influencing our results also. And then third, I promise not to go into the details of this one, but they didn't use the correct tests. And for those of us who have gone through MPH school and we know that there are different tests for ordinal variables versus continuous variables, you may not remember which is which, but you remember that there are different ones. And this group did not use the correct test in some of these studies. Now, as an example, I'm showing you from one of the studies that was done on maternal urine. And in the maternal urine, what they saw is actually looking at the predicted difference in IQ scores based on the fluoride in the mother's urine. And overall, they said that there were actually not, it was a better outcome with fluoride. But instead, what this group did was they focused on the fact that there were some places where they were negative and chose to highlight those in their analyses. So furthermore, none of these Just one little geeky statistical point. If you notice, they go from a negative number to a positive number. And any of us who have gone through basic biostats remember that if something crosses zero on these tests, it's not statistically significant. So they talked about it as though it was important, but their own statistics show that they can't say it was any different than chance. And so we can't rely on that. Now, I don't want to focus too much on the negative. Let's look at some examples of how we can be reassured with fluoride studies. The first is another meta-analysis I had the pleasure to contribute to. And this was a meta-analysis taking their studies and breaking them by people who were in studies comparing high levels of fluoride versus appropriate fluoride in the upper part. And the bottom part is people who are comparing appropriate fluoride to low levels of fluoride, and what the result was for each of these on IQ. So we're taking their own studies, but separating them in the way that I just mentioned. And what we see is, highlighting here on the top, that if you're comparing too much fluoride to the recommended amount of fluoride, IQ is better with the appropriate amount of fluoride. That's what our diamond here shows. And similarly, if we are comparing on the bottom, the right amount of fluoride versus lower fluoride, again, you're better off with the recommended amount of fluoride. The IQ is not different if they lower the fluoride. So there's no benefit to lowering the fluoride from the recommended amount. There is a problem if you lower it from the higher amount. Last, with this study, basically it comes down to the bottom of saying, we come down to the bottom of saying, mathematically combined, we still have a benefit overall favoring appropriate levels of fluoride. So I realize I'm pointing with my pointer and I'm not sure you're seeing that, but hopefully you followed me as I walked through with building those slides. Let's go to some other examples of this. When we look at studies that were done with countries comparable to our situation, so looking at studies that in New Zealand, Canada, Spain, and Australia, and comparing fluoridated water to non-fluoridated water. So the blue bars represent the fluoridated water, the green bars represent non-fluoridated water. And the lines are so close you can barely see it with your eyes, so we put the numbers above. In every single one of these cases, countries that fluoridate similarly to us found that fluoridated water gave the result of an IQ the same or slightly higher. Statistically, I think we wouldn't argue that it's truly higher, but at least slightly higher than in non-fluoridated settings. So blue higher than green on each of these in comparable settings. So a reassurance to us that they are not causing problems by use of fluoridated water, and maybe a little bit of benefit, but at least no deficit. But we still can raise the same problem that I raised with the other studies and said, well, yeah, okay, that's closer. But does that really apply to us as we are in the United States? And I am so thrilled to share with you the next two studies, the first and only studies of their kind done in the US on this topic, released over the last year. Both were done by Rob Warren and his colleagues. And the first was actually done and published in Science Advances. And I'll highlight to you that this was published not in a dental journal, which actually means that this Science Advances is one of the top journals in the country. And so it it means that it's exposing to people who are outside of just the dental world, not just the dental world. We are not just anything about, yes, anything about you all as LOHPs, but I'm saying that this is showing that it is important to epidemiologists and important to public health people, and a higher level of reach with this publication, saying that they were looking at childhood fluoride exposure and cognition across the life course. Now, I'm going to show you the data on the next slide, but I just want to set it up for you before I do. What they did with this study across the US, they looked at people who were either in a sufficiently fluoridated area for all of their childhood, part of their childhood, or none of their childhood. So 3 categories. And then they did testing, cognitive testing, so perhaps more relevant in terms of outcome. They did this testing on adolescents, so also more relevant and stable in terms of their age and what results they get on cognitive or IQ tests. They looked at them in adolescents, and then they also looked at them in adults who were around 60. And what we see, I feel like I should ask for a drum roll before I flip to the next slide. But what we see is this. In every case, for the adolescents looking at their math, reading, and vocabulary performance, in all cases for adolescents, their scores were higher, statistically higher, for having fluoride for all or part of their childhood as compared to none of their childhood. So actually, kids did better being exposed to fluoride for at least part of their life. It did not show a difference for adults. And this one is probably in part because it's a little bit harder to track their exposure over time. But what we do see is that there's no worse for adults who have been exposed for all or part of their childhood in their overall cognitive functioning. Okay. So really, really important addition to our literature and to our understanding of fluoride's impact over the life course. This same group did a similar study. This was published in the the Annals of the Proceedings of the National Academy of Sciences. And in this study, they looked just in Wisconsin, but they were able to actually track location by every 10 years of life because they were able to link location to census studies. And so they were able to look over it over the lifespan. This one, they did actually have IQ results. So they were able to look at those IQ results and compare them, as you'll see on the next slide, with having exposure from birth, from age 7, or from age 14, as compared to never. And what we see again with this study is that there is no decrease for the full sample overall, or for those who lived in the same county from 11 on or from birth on, no decrease for their for their IQ scores, looking everywhere from age 16 to all the way up to age 80. Now, yes, there are some dips in these, and I think that will happen, and we can acknowledge as statisticians that, if you flip a coin, one out of 20 times, you're going to get a different result than you expect, right? This is statistics. This is our process of understanding. The gestalt of this is, again, to reassure us that there is no decrease, as was intimated by these early studies. There is no decrease in intelligence by being exposed to fluoride over an extended period of time. And so, in fact, with that, I want to give you one last example, which is from Calgary. Some of you may know that Calgary is a location that ended fluoride about a little bit over a decade ago. And before they did, there were two cities that were nearby and similar. Edmonton, which is shown here on my graph in the gold bar, and Calgary, which is shown on my graph with the blue bar. What you see is that prior to this period of time, Calgary actually was doing much better than Edmonton in terms of their rates of caries. This is people who have experienced at least one cavity. I would still say 50% is too high. I would wish none for my patients and my community, but still, it's doing better. But then they hit this period of time where they ended fluoride, and what you can see is their rates went up and actually went up again to the point where they flip-flopped, and they were doing much worse than Edmonton was after having their fluoride turned off. And in fact, as a result of that, Calgary this last summer started fluoridating their water again. And they said, we realized that we made a mistake. This is science where we may have acted too fast, but they looked at increased infections, increased hospitalization, increased need for general anesthesia after having the fluoride removed, and they've just restarted it. So I hope those are some pieces to help reassure you about some of the news that's out there right now. What I'm going to do now is I'm thrilled to introduce my colleague, Marjorie Stocks, who will talk more about the process of dealing with a rollback. Marjorie, thank you so much. I always learn from Marjorie, and I'm glad you're here today so that you all can learn too.
Thank you, Susan, and thanks for a great presentation. I think it's really helpful when people go out into the community for some real-world application of what you just described, that they can feel confident when they're going before a governing body of a city council or a board of directors. So we'll begin. I'm going to talk about a rollback today, and glad everyone can join us. And I just want to say before beginning, I think I've talked with many of you over the years about how we get fluoride in the water, how we implement, but today I'm going to talk about how we keep it in the water because that's what we're concerned about. I think this is one of Susan's. There we go. Okay.
Just saying that we have a lot of, even if we're going to deal with this, we still have a fun amount of time working together. So,
all right.
Yeah.
Several photos. Okay, so here we go. How do we prevent a rollback? I'm part of the team at UCSF. We have a good group. We are small but mighty. Susan just spoke, and Susan is our team lead and our scientific go-to person for fluoridation. We're glad Mark Bartson, a fluoridation engineer, joins us. Mark was formerly with the State Water Resources Control Board. He was the fluoridation engineer for the state, so we're very glad to have him. So today I'll talk about what is a rollback, the reasons or causes for the rollback, how it begins, what is effective action you can take, and what resources do you need to take that action. Most of what I'm going to talk about today can be found in the fluoridation manual. It's available on the COTAC website, and if you're not acquainted, I encourage you to go take a look at it. Specifically, the information on rollbacks begins on page 25 of the fluoridation manual, just to get you started. So what is a rollback? It's a term we use in fluoridation to refer to the cessation of fluoridation by a water system. A rollback can occur in a community that's been fluoridated for many years. It can also occur in a community that has been fluoridated for only a few years, as occurred many years ago in Southern California. So the first thing to do is to activate your rollback response team, and that's us. Contact your colleagues at the Office of Oral Health, Rosanna, Paula, and Cindy, and also contact the UCSF fluoridation team because we're here to help, and we're here to help you shape a response appropriate for your community. So what is the first thing you need to do? You really need to investigate the reasons for the rollback. Why was the cessation proposed? Who initiated and who supported the cessation of fluoridation? You need to backtrack through the minutes, through the agendas, of the city council or the board meeting the board meeting to determine what was the dialogue? How did this begin? Is there someone who still supports fluoridation? Can you work with them? Is this proposed cessation a measure to save capital or operating funds? They have to approve it every year in their budget. If it's a financial issue, can you assist in locating funds for operations costs? This is difficult. But more importantly, can you develop the support from the governing body so that they continue to allocate the necessary funds for fluoridation? Sometimes it can get technical. Were equipment problems a factor? Do they need to redesign the system? Was it difficult for them to obtain the fluoride chemical? Were there delays in the shipments? And you may need the resources of a water engineer to help you through that. So again, I invite you to contact us. It's going to be important. It's vital to form a coalition when this occurs in your community. And I invite you to form a steering committee so you can in turn develop your coalition. And I encourage it to be broad-based. Reach out to your partners across the community. Go outside of what we traditionally refer to as public health agencies when we're talking about oral health. It's really important to have a plan of action. And part of that plan will be how you're going to develop your communication strategy. How are you going to confront misinformation? You need to be prepared in advance. You need to have talking points so you can be effective before these elected officials. And of course, Susan is very available and has lots of points, methods to help you through this. And letters will be necessary. You have to send them to the decision makers so that the folks who are governing the water system know that the community is interested in continuing fluoridation. It's important to be proactive. Time is really important in this particular circumstance. We've had situations where we've had a weekend to really respond to a challenge. So it's important, once you hear of this, to monitor the agenda, to monitor the board minutes. Don't assume that it's going to go away. It will not. And again, community engagement is important. The elected officials want to hear from community leaders. They also want to hear directly from the ratepayers, the individuals who drink the water. These are their constituents. It's really important to respond quickly, and one of the major reasons is it will save money. It's much easier to kind of get in the way to disrupt this process than it is to get them to turn the fluoride back on once it has ceased. If the fluoridation equipment is idle, problems can arise. If they need to turn it back on, it may cost more money, which is something the elected officials are trying to avoid. So it's really important to respond quickly. What is advocacy and what is lobbying? In fluoridation, we advocate, we educate, and it's important to remember that advocacy in fluoridation is a negotiation. It's a dialogue with the elected officials. It's a dialogue with your community. Advocacy is the promotion of an idea that is directed at changing a policy, position, or program at an institution. Lobbying is the attempt to influence the legislative body through communication with a member of that body. This information is in the fluoridation manual. I strongly encourage you to review it before beginning. And most importantly, be sure to check with your administrator before beginning any advocacy effort in fluoridation. It's really important that you are all on the same page, that you're in concert with your administrative team, and they can be very helpful to you. So I have some real world examples. We have been on the ground in the community, working with our local groups and helping to back them up. And we've had some terrific responses recently. So I'm very proud to present these examples. The first is Olivenhain Water District. It's a municipal water system in Southern California, in San Diego County, Northern County, near Encinitas. And that's a picture of the beautiful elfin forest, which is in their catchment area. So how did we learn? We first heard that Olivenhain was considering stopping fluoridation when someone from the State Water Resources Control Board reached out to my colleagues at UCSF. They were asking for funding for ongoing costs for fluoridation. The board of directors indicated they were at a budget crunch. This is not unusual. It's very common, and they were looking for funding. I immediately went to research the board minutes and agenda from the prior year. And actually, I had to go back 2 years to locate the initial dialogue surrounding this issue. Olivenhain began fluoridating in 2013. So what did we do? We organized, or rather reorganized, because we had a very strong coalition in San Diego County, in that district, when we first fluoridated that system. But we sent letters and emails to board members. We engaged the local oral health program. We again engaged the county dental officer and the public health officer. They sent letters to the board of directors. This is vital, and I can't tell you how influential this is. It's really significant. Our partners contacted board members to re-educate them on the benefits of fluoridation, to provide an update, a scientific update. And we reached out to the State Water Resources Control Board district engineer to help us walk through this process. We went before the board, provided public testimony. We presented fluoridation as a public health measure. We used the return on investment infographic that was prepared by CDPH. It illustrates the cost savings with fluoridation, kind of what would happen if you stop. And we made a case for social equity. This is a picture of that graphic. It's available on the COTAC website. So more than one meeting was required. We had to attend more than one. And this is, again, very common in fluoridation. It's rarely a one and done. And the outcome here was that fluoridation was paused while they reconfigure the system. What this means is that the local coalition really was effective. They were able to change the direction of that board. We were able to get them to sustain fluoridation. They allocated funds to redesign the system, and they're in that process right now. And before I leave this section, I want to give a big shout out to Tuka Zokai, my colleague at CDA, and also Angela Landsberg at the San Diego County Dental Society, who was very, very proactive in helping us get this done. And of course, Nancy Starr led us to Dr. Phaedra White, the county dental director, and also the county health officer. This is from the Olivenhain website. You can see we love the word paused. Again, thanks to Tuka, the Olivenhain Municipal Water District has paused fluoridation to pursue improvements. They're in design, as I said. That's a photo of the group, some of us at least. Tuka is there. You'll see Angela Landsberg on the far left, Cindy Yamasaki from CDPH, Nancy Starr, and some of our dentists who were very effective in helping us get this done. Moving along to Orange County, the city of Huntington Beach. So how did we hear? This literally, we had a weekend to prepare for this. And again, thanks to CDA. We heard initially from the American Dental Association. The city of Huntington Beach was fluoridated since the 1970s. CDA again contacted the Orange County Dental Society president. They were able to mobilize speakers. They were prepared with evidence from communities that have stopped fluoridating. They garnered 150 signatures in support of fluoridation. And again, they did this within a matter of days. They had letters from the American Academy of Pediatrics and the American Academy of Pediatric Dentistry. 34 letters were sent to the council. It's important to be aware that this information went to the city council prior to the meeting, and the outcome was that fluoridation was removed from the agenda just prior to the meeting. It was amazing. It was what I call a disruption. But this was community action, I think, at its best. And what we will continue to do is to monitor the situation and see if anything further develops. That's a bit of local press. I think it's the Orange County Tribune. So they say it exactly how it happened. The fluoridation item was dropped from the city council agenda. So as I mentioned, we'll continue to monitor. So moving along to the city of Santa Maria in beautiful Santa Barbara County. We were there some time ago, but I wanted to bring this back because it really illustrates the power of a very broad-based coalition. We were there in 2018. However, Santa Maria was fluoridated in the year 2005. And in fact, when they were in system design, there was a ballot measure opposing fluoridation. We had a very strong coalition in Santa Maria, and we were able to defeat that ballot measure. And the city moved forward with fluoridation in 2005. So you can see it was in the water for some time before they stopped. And when we discovered this, it really had stopped. It was ceased. So we learned when a former coalition member contacted us, a dentist that was very active in that community. And what we realized was that fluoridation had been removed from the water district budget. The operations costs are typically a line item in a city budget, and it had been taken out. The budget was passed, fluoridation ended. My colleague contacted the city manager to really get the backstory on what happened here. So we immediately went to work. We contacted the local oral health program. We had worked with them in the past. We were able to contact previous coalition members. Some of them were still available. We engaged the private dental community. It's important to engage the private as well as the public dental community. We contacted the Santa Barbara County Office of Education. They were with us the first time. We engaged the Promontoris group. Again, they were with us in the prior version when we first fluoridated the community. Of course, the county public health department was there. Area Agency on Aging was with us. And again, never underestimate presenting never underestimate the value of presenting the benefits to seniors when you're going before an elected body. It's important, the benefits of fluoridation. The community health centers of the Central Coast were just key players in all this and helped us network very effectively in that county. So we re-educated and re-educated some of the newly elected council members. We were effective through networking in actually developing a new champion on that city council in a very short time. Letters of support were sent to re-educate council members, and the outcome was that the city council voted to restart fluoridation. So this is from their website. It says that fluoridation was reinstated in 2020, and I'm referring you here to the water quality report. It's really a good idea to get acquainted with this report with your retail agency. They talk about fluoride. You can determine the level of fluoride in your community's water. So I encourage you to get acquainted with that. Once again, take prompt action, turn to your colleagues at CDPH, contact the UCSF team, contact Susan for help with the science. She's terrific and will help talk you through it with talking points. Turn to the Fluoridation Manual for tips on how to organize your coalition, on suggested choices for building that coalition, and for how to prepare your team before you present before an elected body. Be proactive, monitor the system changes closely. This is all public record. Don't assume that something will happen without your effort. Community engagement is essential, and the elected officials want to hear from the community. They say it to us directly when we enter the room. So they want to hear from your community leaders. They also want to hear from ratepayers, the folks who actually drink the water. Thank you for joining us today. And I think we're moving on to Jennifer. Is that correct? Glad Jennifer Fitzpatrick can join us from Sacramento. Jennifer's been a terrific team member in addressing fluoridation.
Thank you, Marjorie. Hello, everyone. I'm happy to be here as well, talking about communication strategies in a shifting fluoride landscape. And I'm going to let Khadija advance us to the next slide. Thank you, Khadija. First, a little about where we are. Sacramento is a large and diverse county, and it has very many water districts. Many of our largest districts provide fluoridated water to their customers, which results in about 65% of our population having access to fluoridated drinking water straight from their tap. And this was really made possible by partnership with First Five. First Five Sacramento laid the groundwork for our current community water fluoridation landscape. They contracted with the water districts and they paid the upfront costs to get us to that 65% mark. And in return, the water districts agreed to 20-year commitments to continue fluoridation. But those contracts are beginning to expire in the next year. So we're currently in a SWOT analysis phase. We are coming up with strategies to address the threat of a rollback with the support of Office of Oral Health, which I just learned during Marjorie's presentation has a name, the Rollback Response Team, which I love, and it makes it sound like they're superheroes, which it seems like they are, and our partners at MCDAC, the Medi-Cal Dental Advisory Committee. So that's our coalition. And next facet of the response is to develop a communications plan. And fortunately, we began positive fluoride community water fluoridation communication strategies and campaigns 5 years ago. Next slide, please, Khadija. So 5 years ago, we established a baseline. We did a survey that was specific to community drinking water. And our intent was to see what are the attitudes and beliefs about drinking water and drinking fluoridated water in our community. And what we learned was that 71% of the people who responded agreed that fluoride is good for your teeth, which is excellent news. But only 42% of them agree that tap water should include fluoride. So people think fluoride's okay, they're just not sure it should be in the water. And the ones who said that they think that it should be in the water said the reason they gave was because fluoride prevents cavities, which is simple enough, but it's very valuable information because what we're learning is that specific message will drive acceptance. So we use that. Next slide, please. Fast forward to 2025, last year in the summer, we're surveying the community as part of our update to our oral health needs assessment. And we wanted to see if there had been any change in attitudes and beliefs. So while the survey was focused on a lot of things, not just fluoride, we wanted to at least have one question that we hoped would give us an idea of whether there had been a shift. So we asked, which of the following best describes your beliefs about fluoride in drinking water? So we can find out specifically how they feel about fluoride in the water. And what we learned was that 54% of the people who responded believe that water with fluoride makes teeth strong, which we feel indicates a slight increase in acceptance from the 5 years before. It's modest, but it's encouraging. We'll come back to that to talk about how we may have driven that change, but I really want to talk about some of the other results, which I find equally compelling. Only 19% of the people said they're concerned about possible health risks of fluoride in water, which is a minority, and it's down from the 29% who responded that way in 2020. 11% say they don't think the benefits of water with fluoride are proven, so they know about it, but they aren't sold on the idea. And we know we can help with that because we have decades of evidence to offer and we have appropriate materials to share. But the real opportunity that I see here is the 17% of folks who say they don't know enough one way or the other to have an opinion. And those are the people that we want to reach. They have been our target audience for every campaign because and we hope that the modest increase we saw from one survey to the next means that we're on the right track. Next slide, please. The way that we started, the very first campaign we ran was the social media campaign. We ran it for 5 weeks in the summer of 2022. It was on Facebook and Instagram. The ads ran in English and Spanish. There was one post each week for 5 weeks. The ads were adapted from Fluoride for Texas after they graciously worked with us to brand their specific materials to make them for Sacramento County. And after that work, they rebranded themselves Fluoride for Smiles to make the materials more accessible to locations outside of Texas. So these are available in a social media toolkit that you can find at fluorideforsmiles.org. The ads are targeted to caregivers of children. They were focus group tested. Their intent was to promote awareness and acceptance of fluoridated tap water. At the time, we wanted to encourage people to drink tap water. The contract expiration that we're now looking at and the potential rollback seemed very far away at that time. So our goal was to drive traffic to our webpage on community water fluoridation where people can find more information. Next slide, please. And this is what we learned. Data and analysis provided by the vendor who ran the campaign gave us a picture of which demographic was most engaged and with which image. So we got 2,482 clicks to our webpage, which doesn't sound like a lot, but it's 5 times our average. So we count that as a success. Our goal was to drive traffic to the webpage, and that happened. The ad that said tooth decay gets in the way of learning received the most sustained interest. And the demographic that was the most engaged were female, aged 35 to 44, or over 60. So from this, we can get a picture and we can see where we're having an impact and what message is resonating with those folks. Next slide, please. The next step, when we were ready for another campaign, is we developed a billboard. So we kept it positive. We knew it was going to be used as a billboard, so the message is short and sweet. We did a poll of Sac County Public Health to come up with a slogan, and this results, tap into a healthy smile is what we settled on as a result of a mashup of a couple of suggestions. Water with fluoride keeps teeth healthy for life. So we just kept it positive. It's designed to encourage people to drink tap water over any other drink. And we actually use this a lot in other promotions aside from the billboard campaign. Next slide. But we did run that billboard for 9 weeks. And in addition, we adapted the asset to work for a transit shelter ad. We're intending to target pedestrian and vehicular traffic. And we got reports on the number of impressions. So we ran 100 transit shelter ads for 9 weeks, which resulted in 53 million impressions. So potentially 53 million sets of eyeballs on this ad. And then the electronic billboard display resulted in another 1.3 million impressions. Next slide, please. And as a bonus, in conjunction with that campaign, we ran a targeted mobile display ad campaign. You can go ahead and click through, Khadija, because I just have examples here. So ads were retargeted to mobile and desktop devices for folks who were in the vicinity of the transit shelters and who fit the target demographic, which were households with children in areas where the water is fluoridated. And the intent is to enhance the brand, expand the reach, and drive engagement. If people were engaged with the ad, they could click through to the website. So this delivered an additional 1.1 million impressions, and the click-through rate was 0.35%, which sounds very modest, but the vendor tells us that the average is 0.21%. So this campaign over-delivered in this area. And in real numbers, what that resulted in is almost 4,000 people clicking through from the ad to our website where they could receive additional information. Go ahead and go to the next slide, please. So these just show what it looks like on someone's device with the ad there. You'll have to click through a few times. And so because that image seemed to be successful, we used it in other places. This is our Brushbook Bed in a Box kit. It's our early oral health education kit that we distribute to preschools, and we call it Brushbook Bed in a Box because it includes oral health literacy information as well. But we printed the mailing box that we use to distribute these kits with the image Tap into the Healthy Smile. It's actually on the size of the box you can't see in this picture, but our fluoride messaging is on the box. The boxes include a Potter the Otter, A Tale About Water, one copy for each family, fluoride flyers and posters for the classroom. So every family is receiving messaging that encourages them to drink water and that fluoride is good for teeth. At the same time as this promotion, we provided very similar kits to primary care providers. It was an early version of our Oral Health Champion toolkit. We used the same box, posters for the exam room and waiting rooms, and books, Potter the Otter books for waiting room use, so kids could read the books while they're waiting to go into visit the doctor. At this time, the National Children's Dental Health Month poster from the American Dental Association was about community water fluoridation. So those are the posters that were distributed to all of the Medi-Cal pediatricians in Sacramento County to hang into the exam rooms and the waiting rooms. Next slide, please. With the goal being that fluoride message is included in every touch point. So with members of the community at health fairs, they receive this flyer. Every person who comes up to our table receives one of these flyers in addition to their toothbrushes and other goodies. It's in the Brushbook Bed kits. It's in our Oral Health Champion toolkit. It's in every provider training folder. We have positive fluoride messaging in every training and presentation we do, whether it's to parents, educators, healthcare professionals, or dental professionals. It's sometimes just 2 to 3 slides, and it always ties into the broader subject matter, but it fits into the conversation. If we're talking about oral health literacy, we're talking about health equity, we're talking about community water fluoridation. If we're talking about sugar sweetened beverage reduction, we're talking about drinking water, we're talking about community water fluoridation. So we saturate our outreach with brief positive fluoride messaging. This is the flyer we currently use. It's available from Smile, California, and you can't see here on this image, but it can be co-branded with your county for free. It talks about all the different kinds of fluoride, which we think is really valuable, and it is available in English and in Spanish. Next slide, please. We also lean heavily into advocacy with dental professionals, healthcare professionals, and educators. Surveys tell us that people trust the information they receive from their healthcare professionals. So that 11% of people who said they need more evidence to be convinced of the benefits of fluoride, we encourage them to ask questions. Ask your doctor, your dentist, your midwife, your school nurse, because we've been preparing them to answer those questions for years. Community water fluoridation is incorporated into all of our outreach with key partners. Slides and presentations and trainings, flyers in the toolkits and training folders. It's included in our recorded webinars, resources that we distribute at events, in our newsletters, because what we're hoping is that this positive messaging will have a trickle-down effect to the community. Next slide, please. And there's so many good resources to share. We want to share the information that our key partners need to feel empowered and confident having the fluoride conversation and addressing questions. We keep the information focused on the benefits to oral health. We avoid fighting the negative because we want to lift the positive. The cost savings are compelling. The fact that it's an equitable intervention is compelling. We emphasize the decades of research and we contextualize new findings when they come up. Materials are available for every possible audience: healthcare professionals, water professionals, members of the community. We include stainless steel water bottles in some of our promotion and outreach because it goes with the tap water message. Many people drink bottled water, especially when they're outside of the home, which usually doesn't contain fluoride. So we give a stainless steel water bottle to go with the message, encouraging people to drink tap water. These QR codes will lead to some of the assets and printed resources that we share. Next slide, please. And as we continue to gather allies, we can't forget the water professionals. We developed this print ad to thank water professionals for the work that they do. We placed it in Source Magazine, which is a professional publication of the American Waterworks Association. It has a digital and print distribution of 32,000. And because we placed it for a year, they graciously included a published article to be included in the magazine. So Dr. Fisher Owens is working on that so that the water professionals become further educated on the benefits of the work that they're doing. But in the future, now or in the next grant cycle, when there isn't as much money for doing those types of media, there's other ways to reach the water professionals. We've been on plant tours. We invited some to come speak at one of our advisory committee meetings. Visit your water district websites because the water districts are very active in the community. They attend events, they agree to speaking engagements, they do presentations at schools, they do offer tours. Some of the photos here of are an event in Carmichael Water District here in Sacramento County. It's called the Founders Day event, and Carmichael Water District attends every year. Carmichael is not a fluoridated community, but we take a goodie bag, we go out there, we shake hands, we give them a water bottle, we give them the handout that's tailored to water professionals, and we just make ourselves visible. We are developing those relationships. Next slide, please. We make an effort to find opportunities, but we encounter challenges as well. This can be an adverse climate. There's new visibility, headlines, legal challenges, and political shifts. Some of the folks who have never thought about it before are forming their opinions, and those are the people that we would like to reach. In all of these efforts over the last 5 years, the only negative feedback we received was one incident of graffiti, and the vendor immediately replaced the image. Our public health officer did decline to make a public statement in support because of the controversy in the climate. Our 2025 media campaign on community water fluoridation was canceled because the county wanted to avoid any negative feedback. But when we hit a wall, we look for a window. We did run a campaign on sealants and one on drinking water instead of sugar sweetened beverage because we know that at least 65% of our residents have the benefit of fluoridated tap water. So we can keep our messaging semi-neutral by recommending people choose tap water over sugar sweetened beverage. And 65% of the time, the water will contain fluoride. So even if we're not actively influencing opinion, we can still encourage protective oral health behaviors. And now we have these contracts expirations that are approaching, and we have to address the possibility of a rollback. So we were hoping to quietly let them expire, and we hoped everyone would just continue with status quo. But then, folks from the other side of the argument have been handed a platform, and there's a tension whether we like it or not. So we're formulating a plan to address it. We're gathering information, we're collecting data, we're taking the temperature so we can respond accordingly. The Sacramento County PIO team is media trained and they're looped in, so they're prepared to respond to inquiries and attention. And we know that community support is absolutely necessary. So that's what all these efforts we hope will lead to. I thought Dr. Fisher Owens' suggestion of lawn signs was a great idea because we want to rally support. We can use Calgary as an example. When the majority is in favor, they need to make themselves heard so that the very savvy and vocal minority aren't the only ones making noise. The decision will more than likely come down to a question of funding. So our strategy is to offer a counter argument to decision makers that the benefits outweigh the costs and that the community is in favor. Slide. Feel free to reach out if anyone wants copies of the resources that I shared. I'll also try to include some of the links in the chat. But that is my presentation, and Dr. Fisher Owens is going to share additional information about communication strategies and resources.
Yes, thank you. And lots of love in the chat for you, Jennifer. That was amazing. And we really so appreciate that you were able to join us for this and share some practical and helpful pieces. I'm going to move on and breeze through these pretty quick, but to share with you some additional information, just to say that part of our goal of working on communication came from the fluoride strategic meeting that was held a year ago. Very grateful that Dr. Pendekar, who supports our group, was hosted this with the oral health team, Office of Oral Health team, and our team. And one of the main pieces that came out of it from these lovely people, some of whom you may recognize, was to work on developing a communication discussion. And this is in part important because of all of the negative information out there. This is looking at a 5-month period, 6-month period, comparing the negative the anti-fluoride messaging on social media as compared to the barely visible line for neutral or positive. So we know that there is a need there. Now, for the purposes of today, what I'm going to do is not talk about social media, but to talk about some ways that you might be able to help respond or think through responses if you get concerns. One of the first concerns that comes up for people often is saying, well, that's forced medication. But remember, that is a good thing, actually. We can say that is medication. So for instance, we put folic acid in flour and have helped stop birth defect problems or reduce them greatly. We've added iodine in salt and it has reduced thyroid issues, or vitamin D in milk to help strengthen bones. So these are opportunities. Another concern people might raise is saying that this is a poison, and that's a term that has come up. We don't even want to give it the word on our slides, but I'll say the responses to that are, no, this is a natural mineral. It's naturally in water. 80 years have showed us, and more than 7,000 studies have showed us the safety of community water fluoridation. And I think perhaps the most telling piece with this is to have a problem with community water fluoridation, or to have a problem with that water, you would have to drink 120 gallons of water in one sitting. So graphically, 120 gallons of water. Each of these bottles is a gallon. Yes, you would get sick from the fluoride after 120 gallons of water. You would be sick far before that from the water itself. So another one that comes up for people sometimes is, well, what about hydroxyapatite? Or this is a choice issue, sorry. And in responding to choice issues, people ask if they can use hydroxyapatite. They can, but it hasn't been studied like fluoride has, so we actually don't really know what's going to happen with that. People ask if they can take fluoride out, and indeed they can. They can use reverse osmosis if they want to, but the real consequences is if they remove it. We learned that from Calgary, and I really think we need to take the decision to the end point of not having choice. Because do children have a choice to be born poor? Do they have a choice to be born without healthy food options, or into a family that can't afford fluoride toothpaste and a toothbrush? Because there are people like that who end up dying as a result of a largely preventable disease. This lovely young boy died as a result. This gentleman was a truck driver out working in our community and died. And then you can also get things like having terrible cellulitis or other diseases. So with those concerns, yes, we need to acknowledge to our communities there is nothing without risk, but there are also, that includes not fluoridating. And I would argue that's the bigger risk. Jennifer shared some wonderful resources. I'm going to share also our state dental director, Dr. Penda Carr's statement with our state public health officer, available for you on the CDPH website. There is also wonderful social medias posts that have been designed from our wonderful colleagues in the Office of Oral Health that you are welcome to use or retweet if you so choose. Furthermore, we have available to you through our website, which you can get to through, the Office of Oral Health has their fact sheet, which includes a situational background of what's happened, as well as the key talking points. We're going to drop the link for that into the chat, and more on their facts. So we in the Fluoride Friends, Marjorie described how we can help you. Here is our website to add to the work that others are doing. Really want to highlight that we offer free CE to your water operators, which is a great excuse to reach out to them, learn from them, make a connection, and then offer them this. You're also welcome to join our fluoride work group. Which happens on the second Wednesday of odd months from 11 to 12, featuring a little bit about water systems to help you learn more about the incredibly complex work around us, some tips on communication, little bits of research like I shared, and a community of others who are working as you are. So you can link to us through COTAC. Because we do recommend going to water treatment plants. Here's another one of us, a few more of us visiting some of the plants. Really helps to reach out, get to know those water operators. And I want to tempt you that coming soon, we will have a handout that you can use as an outreach tool to reach out to your local water district. I'd also like to share this wonderful resource from the state that was designed by our Office of Oral Health colleague, looking at maps. And then that infographic, oh, I think I may have slipped that out, but the infographic that Jennifer shared, which also discusses cost issues. I realize that's a question that people had. And I want to mention, let me just see if I've got it. No, I don't. I want to mention that for the cost issue, we know, and it's shared on that infographic from the state, that an investment in water in the community saves money to the community, a minimum of $20 per person per year. So this is an incredible resource, one of the true cost-saving opportunities. So I think there were some specific questions about that. What I'd like to do is thank you for your time and thank you for your work with your communities and letting us know how we can help you with hopefully working to support your communities in many, many ways, thanks to our support from the Office of Oral Health. So with that, I will turn it over to Aubrey. Thank you.
Wow, thank you all so much, Susan, Marjorie, Jennifer, for sharing these excellent presentations. I am almost stunned because it was just so informative and so many resources were shared. And the amazing work that you all do is it's really inspiring. I want to just drop down the slide so we can all see each other for the Q&A. I haven't seen any questions come through the chat, but please do add your questions there or raise your hands. Thank you, Ariel, for doing that. And we'll call on you and just have an open dialogue. Ariel, go ahead.
Thank you, Aubrey, and thank you to all of our presenters. Extremely informative and really exciting to hear real-world applications and work happening. One of the topics that's been coming up a lot in Sonoma County has been around the, I'm going to get the exact name here. It's the California Welfare and Institutions Code 17,000. This is a code that requires indigent care, largely forgotten about with the expansion with Medicaid expansion, but due to HR 1, there are extreme concerns that our county would have to cover additional costs for certain populations. One of those covered costs is related to emergency dental care. And so I'm going to add this info to the chat in case others aren't familiar. All 58 counties have to comply with this law. And then there's some data about dental utilization in the emergency room for each county that I added as well. But I'm curious if there's any, you mentioned Susan, you mentioned the $20 per person. I'm wondering if there's any sort of data or information we can get about the emergency cost. Because while it may save $20 per person, if that's $20 that is not out of the county's budget, they're not going to count it in the same way. So if the county is on the hook for spending money for emergency dental care for this population due to HR 1, and we can say, we estimate you to spend this much for this care over this time period, and it's going to cost you this much, especially if that number is lower, to provide community water fluoridation to address that cost. I think that for us at least could open the door to a conversation which due to costs has just been closed off to us. Not to say that that would pass something necessarily, but at least starting a conversation with that financial piece put together. So just curious if others have addressed this, if this has come up, or if there's any insights from our experts today.
I will be happy to start. We have the information around the $20, which if you insurance inflate is almost up to 40, is more about the savings to the community once community water fluoridation is in place. That does not include the initial investment into the fluoridating of the systems. One of the opportunities to you all in your LOHPs was, as you're designing your grant approach to the state, was to look at multiple ways of instituting fluoride interventions. So given the interesting times we live in politically, that may be a softer approach than necessarily going straight to community water fluoridation, but it is certainly a piece that, as Marjorie mentioned, starting that informational campaign, the wonderful work that Jennifer's doing in Sacramento about getting people more comfortable with the concept of fluoride and the benefits that it has for learning, for instance. And that is a piece that can be built on over the years. But if it's looking directly at costs for a non-existing system, I think other mechanisms of fluoride might be a better approach. There was a recent article that came out that talked about, for Europe, a location in Europe, about community water fluoridation not having as much of a benefit. But this was in a place that had universal school toothbrushing programs. So, it's a different circumstance than our circumstance. And that's why we need to think about where we are, who we are, how we work with our communities, all these wonderful pieces Marjorie mentioned, and then how to work within the world we live right now. So happy to provide some more of those resources offline, and again, you have a wonderful team at the Office of Oral Health who can help with that as well. But I defer if others would like to mention anything else.
Yeah, any other comments to address Ariel's question? All right. Ariel, we can also look into some of the other costs around emergency care, and we can follow up on that and see what kind of data we can find to support. All right, we have another question from Elizabeth. Go ahead.
I'm sorry, it's not a question. I am having major keyboard issues, so I can't
Oh,
type
okay.
into the chat. I'm sorry. But the ADA Health Policy Institute put out a brief recently. It was last year, I think, toward the end of last year, that looked at Medicaid, that looked at state level costs. So it's broken down by state. It doesn't have a county, so it was for all of California, but it was what would happen if you did away with fluoridation, and then it included, all of the dental care costs. So I don't know if that's particularly helpful, but that might be something you want to look at.
Yeah, thank you.
And I'll just add one more piece. Thank you for that, Liz. And I'll add one more piece for Ariel's comment. It's interesting, in New York State, they actually have their Medicaid programs partially fund their fluoride because they see the benefit that having fluoride has for reducing overall healthcare costs. So in a perfect world, we would move that way.
Thank you, Susan. Any other questions coming up from LOHPs around this topic? Any resources that you don't have access to that you really need or want to respond to anything coming out of your local communities around this topic?
Aubrey,
Yeah,
it's Margaret.
please.
I was just going to add to Susan's comments. I think when you're before an elected body or you're talking to any community leader, if you don't have local information, it's very fair to go to the literature. And I encourage you, when in doubt of any local information, go to the literature. It works, it's accepted in fluoridation. And we've gone there many times, especially the recent information from Canada that Susan talked about. Go there. It that will serve you very well.
And Juno, we have research from Juno as well on those points.
Mhm.
Great, thank you both. I'm looking at the clock and realizing we're almost at time. So we're going to go ahead and launch our evaluation poll, and please add your feedback there to tell us what you thought of today's session. But we still have time for questions. So if there are any other questions that folks have, please go ahead and put that in the chat or just come off mute, raise your hand. We would love to hear from you.
I'll also say, I know a few of you put questions in on your registration, but we got them after we had finalized the slide deck. So I apologize we couldn't handle those, but would love to share more in the future as you wish.
This is a question for Susan, and it's kind of off the wall, but was there any, I almost think there was, like, did they look at IQ in Calgary? Did IQ rise after they stopped fluoridating?
I believe they looked at it not in a very controlled way, and there was no change. But I can't, I'm sorry, I'm working with a little bit of a challenge right now, so it's not jumping to my head, but certainly it did not show improvements.
So just wondering. And I'll try to look for that, but because I almost remember there was one. And so I was just wondering if you knew of the study or had seen it.
Maybe in
We
the
can,
past.
yeah, and we can always follow up afterwards too with more information in our
Thank
follow-up
you.
emails. Yeah.
Yes.
Well, we are at time, so I'm going to stop us there. Again, you're always welcome to send COTAC questions, send the fluoride team questions, and we'll be happy to triage and make sure that we get your questions answered. But I want to send immense thanks to Susan, to Marjorie, to Jennifer for your presentations today, for showing up and sharing so much of your valuable insight and work that you do. Very, very grateful to you. And thank you to everyone for coming today and being such present and attentive participants. We hope you have a great rest of your day. I'm going to put a link in the chat to the COTEC event page, just so you can see some other events that are coming up. But have a wonderful Thursday for those local health programs submitting your applications. Best of luck for your 2730 grant applications and getting those submitted. COTEC's always here, so send us a message if you need anything. Take care, everybody.